Good afternoon. I'm happy to be here and to be part of the effort to give birth to the ISQua Knowledge website, so I'm happy to be on it. A few weeks ago, Tim Shaw wrote to me and asked me to participate in this presentation. And he told me that this had to have two special features. One is that it had to be a passionate presentation, and the second, that it had to be different. So I thought, well, Latin Americans are supposed to be passionate, so probably that's not a problem for them. And it had to be different. So I thought, okay, I'm going to try to do something different. So I'm going to talk about issues of quality for people who cannot read or write in developing countries, taking the case example of Indian American populations in Latin America and Central America. And I put onto myself the challenge of doing a presentation without any letters or any numbers, which I've never done in my life, because I want to show the same presentation to them, to the people whom this presentation is about, as well as I'm showing it to you now. So this is, as I said yesterday in a different presentation, Cotopaxi in Ecuador, the highest mountain on Earth. But some of you may say, well, that's Mount Everest. No, this is the highest mountain if you measure from the center of the Earth, because the Earth is wider in the equator. So this makes it the highest mountain. In Ecuador, as in other Latin American countries, like Peru, Bolivia, Colombia, Paraguay, and most of Central American countries, mainly Guatemala and Honduras, millions of people live in rural areas and belong to the original cultures and ethnic groups that were there before the Spaniards came to America in the 16th century. These millions of people also use healthcare, but they have been using their own healthcare systems for more than 1,000 years before Western healthcare came in to Latin America. As a matter of fact, these millions of people have their own beliefs about health, about death, and in particular about birth, about giving birth. So giving birth, giving life for original cultures in Latin America is not a medical situation. It's not a disease. It is a very happy event. It is a joyful event. It is a social event that brings together communities, families, to celebrate life. It is not associated with the concept of medicine, much less with the concept of a hospital. Giving birth makes families larger, which is good, because most of the economy of these families depend on agriculture and producing on Earth. And the cultures of Indian Americans in Latin America have their own health agents, which are the traditional birth attendants. Traditional birth attendants are legitimate healthcare agents, and their legitimacy comes from the communities that have given traditional birth attendants the task the delegation of authority to provide health care and help women to give birth and newborns to enter into life. You can see traditional birth attendants become part of the family during the last weeks of a pregnancy and during the act of giving birth and the first days of a newborn. Giving birth is a social event around the family, around the home. It has to do with the participation of the family. In particular, the participation of the father and other family members. Giving birth for millions of people implies the presence of the family during the very act of giving birth. As much as the mother gives birth, the father also participates in the act of giving birth, as well as the mother-in-law and other family members who provide warmth, emotional and physical warmth, a sense of protection, and a sense of family and community. The traditional birth attendants have their own knowledge, a knowledge that has been given to them generation after generation after generation. A knowledge that is not disputed in its legitimacy by communities. Traditional birth attendants have all the authority to perform health care and procedures during pregnancy, birth, and care for the newborn. As you can see in many, if not all of these pictures, faces show joy. Faces show happiness. There is a sense of accomplishment in the act of giving birth. And again, there's no association with pathology, with disease, with a medical condition. The baby is also provided care for by traditional birth attendants and the family. And there are other features of giving birth in the community that are related to traditional herbs use and special foods and the presence of the family members, as you can see in this photograph, along all this process. However, there was another reality at the same time in Europe, another source of knowledge, a very different source of knowledge. And in the 16th century, a different paradigm, I don't know how, if it's said paradigm or paradigm, sorry, paradigm, came to Latin America. The concept of healthcare and medicine from a very different point of view. The person you are seeing there is the inventor of the forceps. There wasn't forceps in the original culture of Latin America. And many of these developments and the concept of giving birth attended by medical care came into the institution that is called a hospital. So in the 21st century, hospitals now provide health care. And WHO has ruled that in order to reduce maternal mortality and newborn mortality, skilled birth attendance is absolutely necessary. So, delivery in a hospital. Now, what does that mean for what we have seen in terms of culture? It means a forceful deprivation of culture by the institutions that provide official and formal health care. As you can see, there is authority that comes not from the communities, but from a uniform, but from a medical degree. There is the use of very different techniques, very different positions to give birth. family members are not allowed to participate in this social act of giving birth and bringing joy to the family of the community. The woman is completely isolated from her family, from her community. Temperature in delivery wards is not cared for. In the high mountains of the Andes, very cold temperatures are in birth delivery wards. And of course, strange machines, lack of information, and the family members are left outside without no participation, without information. Birth delivery has been transformed by modern healthcare from a social, joyful event into a medical condition implies isolation, culture deprivation, and I almost say aggression for a woman and for a family. And that has led, this is a drawing by a traditional birth attendant. She drew this. On one side of a cliff, the doctor. On the other side of a cliff, the community with the traditional birth attendants. And in the middle, an abyss. The communities have two different healthcare systems, and many times they are forced to use modern healthcare only when they really feel they are going to die. And many times I've heard the expression, I prefer to die at home than in the hospital. Sometimes when we measure the quality of care of those hospitals, we come to believe that might be true sometimes. So what we are doing is we are working with modern healthcare institutions, hospitals, health centers, to try to build this bridge between the two cultures and to bring together traditional, ancient knowledge, practices, the culture of the communities and the families, and blend it and merge it with modern knowledge. Daunting task. I'm not sure how far can we go into that. So far, so good, I would say. But we believe this is the right thing to do. Because for millions of women in Latin America, for millions of families in Latin America, it is their right. It is their human right to have their own culture, to enjoy their own culture, not to be deprived of their own culture, but at the same time, enjoy the benefits of modern medicine and modern science. But not one without the other, which is the terrible choice families have to make every time. But I'm not here to talk to you about what we are doing as a project that works in 6 Latin American countries now. In general, we are trying to bring together these two cultures, having doctors, nurses talk to traditional birth attendants, sitting together with them, bringing traditional birth attendants inside the hospitals, learning from them, teaching to them, understanding a different perspective about healthcare, which is at the heart of a profound concept of what quality should be. And I say, I'm not here to talk about what we are doing, but rather, since this is supposed to be provocative, to ask you what you are doing in your own hospitals. Because I've shown a reality which is just one example of the clash of modern healthcare culture with traditional culture. But I am sure that in many other cities, large cities of Europe, large cities of Asia, where you come from, I'm sure that here in Hong Kong as well, there is also a lot of this problem, because the 21st century has sent hundreds of thousands of people from one place of the earth to another, where they are islands of ethnic groups, islands of cultures, and we need to look into what modern healthcare does about that. Thank you.